Hey everyone, welcome back. So, I just recently came across something that I wanted to talk a little bit about because hopefully it will apply to me sooner than later. So, the University of California has started a program, a research program called Mother to Be. And the whole premise to this program is to gain information and do research on women who are pregnant with multiple sclerosis. They also have a specific section of the program for women who have multiple sclerosis and who have taken Obagio before pregnancy or who were taking Obagio when they became pregnant. So, from what I understand about this program, it's pretty in depth. Obviously, they want to get as much research and information as they can. In regards to the women who have multiple sclerosis and are pregnant, I think they're really trying to determine how exactly pregnancy affects women with MS. In the research I've done and I've talked about, and from what I've heard from other women, pregnancy is supposed to really help with your MS, especially in the second trimester. It can make you feel a lot better, but we do know that there is a high risk of women having a MS relapse in the first few months after they deliver. In regards to the Obagio portion, they're really trying to determine if, in fact, Obagio does cause birth defects on an unborn child. We do know that the company that makes Obagio does make it clear that it can cause birth defects, and you should not take this drug while you are pregnant or trying to conceive. However, with that said, when I decided I wanted to do the flush and try and get pregnant, and I talked to my specialist, he told me that there's actually no research that shows Obagio does 100% cause birth defects. So you kind of just wonder if the company that makes it is unsure if it does or not and wants to be cautious, which is a great thing. However, there are a few MS drugs on the market that you can take while you are pregnant. So I think that really it would be very beneficial to have some solid research and information done to know if in fact that Obagio does for sure cause birth defects in unborn children. In regards to after the children are born, they're actually going to be continuing the research to see if MS in a woman does affect the child as well. From what I've read and from what we know, they say MS is not a genetic disease. There are lots of people that will disagree with that, but research has shown that it's not genetic and it does not get passed on to your children. And I think that they're really trying to determine this and see if a woman who has MS, if this has any sort of effect on the unborn child or after the child is delivered. So with this mother-to-be program, it's very in-depth. As I said, you do a bunch of phone interviews to determine if you are eligible. And then from what it says when you read the information, apparently they do request your medical records from your doctor throughout your whole pregnancy. They continue requesting your medical records for up to a year after delivering. They also request the medical records for your infant for about a year up to after you've delivered. So they do require a lot of information, which I can understand, especially if they are trying to determine specific numbers and percentages and see if there's any sort of data that can show if there's a specific effect that it's having on the child, especially in regards to Obagio. So that is understandable. I think it's really great that they are doing this and they're really making sure they get the proper information to determine if there is any effect to the unborn child. I would say if you are pregnant and have MS or have taken Obagio, it might be something to consider. However, before signing up for this program, I would 100% talk to your specialist about it. When I'm pregnant, if I decide to go with this program, I will talk to my specialist about it because they are going to be requesting so many medical records. You just want to make sure that your doctor is 100% on board with it to share this information as well. Another thing that I think is going to be great with it is determining if Aubagio can be taken while you are pregnant, because a lot of people are having success in Aubagio, and if a woman doesn't have to stop taking it in order to get pregnant, that's information that we really want to know. So the more information I learn about this program, I will definitely share. I'm sure you can go on Google and find some information. I actually came across it on Facebook originally, so I'm sure you can find it on there as well. So thank you for listening to today's video, and I will see you next week.